addicts are discriminated against in ways that people suffering from no other disease are affected. So there's huge discrimination against addicts, which makes it much, much harder for them to recover.
One of the things that is very, very tragic is that many of the insurances don't pay for the treatment of drug addiction.
They don't cover treatment at all, or they cover it with significantly higher deductibles and copays, which is a very effective barrier because people don't have the money to pay out of their pockets.
Managed care has reduced the amount, duration, quality, and intensity of addiction treatment far more than it has reduced duration or any of those parameters in any other area of care.
Addiction treatment cannot wait. We need to help individuals and save lives now. It is because we need to act now to save the lives of those suffering from addiction that we are having another hearing today. This hearing will focus on the impact of denied treatment on crime in our state, on employers, on medical practice, and most importantly, on our families.
This industry has turned their back on the statute of Pennsylvania, that is the law. And I don't want to line the pockets of the insurance people and providers when you have people like these people behind you that have to stand there and hold their sons and daughters before the people of Pennsylvania. It's not fair, it's not right, and it's against the law.
The managed care system has taught despair to families, that my loved one will never get well. It has also got families beaten up on treatment programs saying, you didn't work, when in fact the treatment program was not permitted to provide the care that it knows it needs to provide.
There's nothing that says some bureaucrat in an insurance company, in a health insurance company, has the right to overrule over the telephone without looking at the addicted person, has the right to overrule a doctor, a licensed psychologist who's just spent 2 hours doing a professional, careful determination of what the treatment needs are of the patient. But the suffering that's caused, good God.
My name's Roberta Lowjack. This is my daughter, Ashley. Ashley was my first child. She was a blessing from the day she was born. And I knew my daughter had a problem probably in March of 2001. We went to a rehab center on our own, and they would not admit her to an inpatient treatment, but they did admit her for an outpatient. I like to read a letter that Ashley wrote to me. I'm still young, and I still have something to live for. I don't want to end up like my old friends and be a dopehead my whole life. Because I know I'm here to do something good, and I haven't seen anything in this world so far, and I want to. And I decided that all that was more than enough reasons to quit. I am enough reasons to quit. Mom, I love you. But I called another rehab facility. It was a couple hours away from my home. When we were there, they told me they were going to admit her. They said she would probably be there at least 28 days to start.
Now, was that a surprise?
Oh, yeah. So, because they told me she'd be there at least 28 days. She wasn't ready to come home. I know she wasn't. I knew she wasn't. So, went back home, and Ashley made us dinner, and she went to bed. The next morning, I looked in at about 8 o'clock, and I saw her laying there sleeping. TV was on. She still was holding her remote. And I looked at her fingernails were blue. So I started screaming. I ran out of the room. I called 911, went back in there. I picked her up and put her on the floor and tried to do CPR to my own daughter. But she was already dead.
I've been a prosecutor for 25 years, and I deal with criminal conduct. I'm going to read you a statute that I hope the lawyers for these people will take a look at. Title 18, Section 2504, involuntary manslaughter. General rule, a person is guilty of involuntary manslaughter when, as a direct result of doing of an unlawful act, in a reckless or grossly negligent manner, he causes the death of another person. Is it involuntary manslaughter? There are discussions about that. No one's ever been prosecuted for that. But there's a first time for everything. Those of you in the managed care industry that are looking at this issue, ask yourself, do you want to take this chance? I mean, you're dancing right up to this, up to the edge of this statute.
The thing I would tell a family to do is no matter what they're being told is keep fighting, is to say, no, this is what it says in my benefit, and I need this benefit. If the families don't make an issue of this and dust it up, it's going to continue.
Good evening. My name is Joan Ward. I live in Cranberry Township. This is our son, Rob. When Rob was a senior in high school, we discovered that he was abusing drugs. You've heard a number of very tragic stories here today of young lives lost. Please don't be comforted into believing that these are aberrations. We are not the exception. We are the rule. The world looks at our children and they see druggies, junkies, felons. We look at our children and we see cowboy boots and ballet slippers. We see Christmas mornings and birthday parties. We hold forever in our heart that first instant that we first looked into their infant eyes and we knew in a heartbeat that we would give our very lives for them. Unfortunately, that's the last absolute of parenting. It's all guesswork after that. When you get right down to it, our options really are quite limited. We can build a better system, or we can continue to bury our children. I greatly appreciate your efforts in this area. Thank you for your time today.
Back at work.
Okay, fellas. Thank you.